So welcome everybody. Welcome to the Behaviour Change Individual workshop session. I'm really glad that everybody's here, and it was certainly worth staying for the session on the evaluation. It's so interesting, and obviously from our side of it, it's incredibly valuable as well. And involving our families in it is really good. Anyway, so we'll move on to what we're going to be doing this afternoon. I'm Gill Thornton. I'm the director of Better Start Bradford, and the four ABS sites are also going to be sharing case studies. So I'll introduce them. So we've got Natasha Harrison from Blackpool Better Start, Emily Hamblin from Lambeth Early Action Partnership, Stacey Lockhead from Small Steps Big Changes Nottingham, and Michelle Wellborn from A Better Start Southend. So I'll be doing the sort of main presentation, and then they'll come in. So if we move on, I can give you a sort of overview of what we'll be covering. So we'll be looking at how I'll be doing a little bit of stuff around how change happens, just sort of the methodologies that we use and some of the tools that we use in our ABS sites. And I think sort of want to do that because you'll have picked up from today, if you've been in all of the sessions, how much we've adopted the sort of change methodology or theories of change, so that we have a really good understanding of what we're doing, but also we can learn from it and share it. And so that's pretty much what we've been doing with behaviour change as well. So we'll be sharing the learning from across the ABS sites around how we're working with parents, and so we're very much supporting parents. It's always been alongside parents and being with them. I'll be sharing a case study, and that's our MESH project, which is an enhanced health visiting project. And then the other ABS partnerships will be sharing local case studies to illustrate the change. I'll summarise at the end of that, and then ideally we'll have some opportunity for questions. By all means, feel free to pop any questions in the chat as we're going. So if you want them, we'll aim to answer them as we go. Any that we don't answer in this session will be answered in the event report following the event today. So how do we change behaviour? And there's several theories that exist, and as we know, it's really difficult to change behaviours, and we all know what that feels like in our own lives. And so none of those theories can claim to be a panacea, but they're all worth looking at because they give us a framework to take the actions that we need to take. And all of them look at a process of change. They all take account of the influencing factors. So looking at what else happens within families' lives. Some of them explore theories of community readiness, and a couple of the sites have done work around community readiness. So understanding what's going on in the community, what the understanding is of an issue, and for some of our communities, it's really understanding that this age group has important needs that need to be catered for to start with. Many linked to communications and marketing approaches, and as we know, we do a lot of the things that we do and buy the things that we buy because of effective communication and marketing. So we need to know how to use those tools too. And one of the things I've put up here is the Big Little Moments. That was a communication campaign across the ABS sites, looking at early social, emotional and language development. And it was just lots of characters showing how small interactions can help to build babies' brains and help build that parent-child relationship. And they could be just incidental parts of the day. All of us have used that campaign, and we still use it in Bradford. We've got materials and sort of things to go with it. We've got some inflatables. So we still use that, and our projects use it too. There are other communications and marketing approaches, for example, frameworks. So the Big Little Moments is built on some frameworks work. And nudge theory, which is the behavioural insights work. So how you can make small changes that will nudge people towards changing. So all of those things that we're aware of and we've looked at during the programme and inform the things that we're doing in terms of behaviour change. Okay, thanks. And this is the tool that we've used in Bradford. So it's the trans-theoretical model, and it's basically the cycle of change. And that's it. That's just how change can happen with individuals and with bigger groups. But it's actually starting with where people are, where parents are, and very often not thinking about the change at all, not not being aware of the need to change, or not really understanding that there's anything that needs to change. And so we have to make sure, if, for example, we're wanting to change child outcomes, that we're talking to our families and sharing messages with them through learning, through communications, about what the issue is and what needs to change. And that allows them to then think about, oh yes, well, that may be something that needs to happen. So then start to think about it, but maybe not ready to change, maybe not thinking it means them, which is quite common. And then when they do start thinking those things, getting ready to change. So being prepared to make some changes, or to think about what steps they might need to take and where to get the support and where that happens. And what we do in our programmes is make sure we're alongside all our families at those points in the cycle. And then when they're ready to take action, that's when our projects, our interventions, our programme activities kick in. Sometimes it's our partners' activities too. And the motivation of the individuals means that they will start to make change. The step that follows that then obviously is maintaining that change. And if that's what happens, then it creates a lasting change over time. If it doesn't, and we're all familiar with the relapse kind of process, the cycle can begin again. And because of the way that our program's structured, we're able to support parents in doing that, and parents and our families and our communities. So that's the kind of cycle of change. But we also need to understand what individuals are, how it affects individuals, or how individuals engage with that. So if we have a look at the next slide, what does this mean for individuals? And so we have to look at what happens with individuals. They've already all got their own beliefs. They already have their own understandings of what health issues are, and whether or not the behaviour they're undertaking, what impact it has, and whether changing it will be effective. So we have to take into account their attitudes towards the behaviour, and that's part of the discussions and part of the engagement that we do with them. And then we have to look at where they are in their communities, and that's to some extent where the community readiness work happens, but also the things that are in peer groups, the things that are in those wider influencing groups and within families, and the pressures that are on parents to do things in a particular way. So we need to be able to address those and support parents and have those discussions. And I think, just as a small example, we did some work with grandparents in Bradford to make sure that there was a broader understanding within families. And then they've got to believe they can do it. They've got to believe that they can actually make the change. And so that's another place where the support that we put in is really important. And then they get the intention to act and move on to changing behaviour. So we need to understand the motivation, to be clear where the opportunity is, and to help parents to see that they've got the capability or the capacity to do it. And sometimes that needs a fair bit of support. So through the way that we approach this, the common themes in our message, we're able to meet parents at all of those points. So we build the relationships of trust, and parents feel able to turn to us, to our engagement teams, our programme, our projects, and our comms, to understand or to build that relationship. Help to build the confidence by building on the strengths that the parents have already got and the capabilities they've already got, and involving them in the design and the way our services are structured, and all the programme across the board, so that they can see that their voice is important and they fit in there, and develop the services with them through co-production. Offering support at group, individual level, and linking them to wider services as well as the Better Start services. And then recognising all the factors that affect their choices. So the individual, the social, and the environmental factors, so that we understand what surrounds us, shapes us, and making sure that's part of the thinking about how our services are provided and delivered and built with our parents. And so just looking at the change themes and how we support them. So becoming aware, and I've already said some of this, that we have discussions and activities with parents and respond to the needs. And we go to parents and say, you know, if this problem, there's this issue that needs changing, and they help us to design or think about the solutions to it. We make sure we've got information and share and learning opportunities going out all of the time, building those relationships and communicating key messages. We hear what parents have got to say and what they need and want, and where they're recognising the need to make changes, make sure that we're with them there and discuss with them how they can be supported and what would work for them, and then developing the trust that means that they're ready to take the next steps. Right, thank you. As soon as they're making the decisions to take actions, we can make sure that they're involved in designing the solutions and designing the actions that we will, and they have been throughout the programme for all of us, and you'll see that with some of the case studies. But we also need to make sure we're building in strategies to deal with the pressures that parents are under, because we know all of the areas that we work in, parents are under pressure, and so making sure that we're taking those into account, that the things that are at the right time in the right place, they're accessible and easy for parents to access, and that's broader support, they're linked into broader support where that will make a difference. And so then they will be taking part in the activities and the services, seeing the changes in behaviour, having some new ideas, new thoughts about parenting, some new strategies for dealing with issues or new ways of nurturing their children and relating to them, and being able to see positive change, and that positive feedback really helps for the parents to keep going, and that's what helps to maintain the change. So we provide ongoing support, we make sure that they're linking up with peer groups, and very often one service leads to another, so other services. But also our responsibility is to make sure there are systemic services, systemic changes to support those changes. Thank you. And the learning from that for us, and this is across the whole programme, is that we need that whole system support to make sure that people can make the changes as they want to improve their lives. And that we need, as a programme, as service providers and as partners in this programme with parents, to be flexible, because that's how we effectively support change, to build on strengths and be non-judgmental, and to make sure that there's opportunities for peer-led approaches and for parents to volunteer and to be part of the delivery. So providing coaching and training for parents and our community to do that, to make sure parents are empowered and they've got a sense of control, and to be genuinely in control for children, families and practitioners, so that individuals can make choices and have a sense of personal agency over those choices, and get feedback from the parents about what difference it's making for them, so that we can change and we can make sure we're getting it right. So absolutely listening to parents, and that's part of our evaluation, as well as just collecting numbers, and then making sure that the programme we've got an understanding of the programme, of the different stages of behaviour change, and that's what leads to the permanent change. Thank you. So the case study that I want to share with you is MESH, which is our maternal early childhood sustained home visiting project in Bradford, which is the new model of health visiting, and how that's supporting change. It was initiated by Better Start Bradford, but sits entirely within the Care Trust and is run by them. So if we move on to the next slide, I'll tell you a bit about it. So it's a structured programme of home visiting, and it allows the organisations and the practitioners to work in a preventative and early help approach to improve outcomes. It's effective for vulnerable and at-risk mothers and mothers living in areas of socioeconomic disadvantage. And there's a strong evidence base for it, developed primarily in Australia, but developing in this country. It's flexible to meet the needs of all families, so families where there's more than one child, all ages and family members. And it's managed and delivered by the health visiting service. So the health visitors have got a considerable amount of autonomy in deciding whether to bring families into the MESH programme and to deliver the MESH programme to families, and to identify those families early on when there's a risk of them having poorer outcomes. So the model itself is, if we move on to the next slide, there's a minimum of 25 home visits by the health visitor, and it allows the health visitors to develop a strong, trusting relationship with the family. So often a therapeutic relationship. It commences in early pregnancy and continues for up to 2 years. Early discharge is possible if the family are okay and can move off on their own. It can commence later than that if the family doesn't present until later. But also if the child is, the baby's in hospital for longer, or the family is. And as I said, it's for first time or for second or third time mums and carers. And it can be delivered in the home, but also in community settings or in groups if that's the preference. And health visitors will sometimes encourage the mesh mums to set groups up to support each other. Right. And the approach is to stop taking a fix-it approach, to try to make sure that the approach is looking to what's happening, knowing the family, working with the family and anticipating what happens. So an example is a 19-year-old who is having her second baby. She already has problems with a 2-year-old toddler who's got what's deemed to be behaviour problems. She's already got a behaviour programme for that toddler. She's feeling down and depressed, so she's been referred to the GP, and the GP's suggested she gets some support, mental health support, so that's added on. She's struggling to breastfeed, so she then gets the breastfeeding intervention. And then she's postnatal depression, so she gets some listening visits. And as the toddler behaviour has deteriorated since the new baby's arrived, she's encouraged to take on another parenting programme. And none of those things actually deliver the answer because they're too disparate, and she's already struggling with the responsibilities and the load that she's got. And what the health visiting service says, they could have anticipated that and could have predicted because of what they already know. And with MESH, you can get a programme in at the beginning, which means that all of those other things don't necessarily need to happen, or they're taken on at the right point. Thank you. So what their goals are for MESH are to improve the transition to parenting by supporting mothers in pregnancy and as early as possible, improving maternal health and wellbeing by helping mothers to care for themselves, and by helping them to improve their child health and development by interacting with their children in developmentally supportive ways, to develop and promote their aspirations for themselves and their families, and to improve their relationships within the family and the wider network, and to link them into support. It can be any carer, and MESH is now looking at ways of supporting children going into care too. And so I just want to talk a bit about the modules. All MESH programmes have modules, and these are the ones that we've got in Bradford. And so their learning to communicate is delivered from birth to 12 months. And it's got all the a number of different elements to it, which help parents to understand how their children learn to communicate and what they can expect from them, and gives them activities they can do. Healthy Beginnings focuses on health and family health, and includes maternal infant nutrition, but also things like stopping smoking and adopting healthier lifestyles as a family. Habit is an oral health project which we developed as Better Start Bradford, which introduces early oral health or early tooth care, even though before babies have teeth, encouraging parents to see that as an opportunity to start that. And also it's provided through health visitors and early years settings, so there's a reinforcement of the habit intervention. And then first relationships, so helping parents to understand what's going on with their babies. And we use ready to relate cards, which show the cues that babies are giving, that they're ready to talk to their parents and they're ready to be spoken to and to be interactive. You know, the interaction helps to develop their well-being and their early development. So all of those are used, but we also have family hubs in Bradford, and so the family hub services, they're added onto those. So for example, things like Henry, which we also offer. Right, so I want to talk to you about our case study. The case study is it's a Mary Poppins case study, and this was given to us by a health visitor who got called Mary Poppins by a family. I'll talk to you about that. but it shows how the health visitor built the therapeutic relationship, and therefore the family was enabled to move on. So I'll run through the story. So the health visitor recruited a mum recently into the programme, didn't see her antenatally because she gave birth early. But in the first birth contract, she walked into a home where both parents were in mental health crisis. They'd come home with a newborn baby. Mother had birth trauma and was struggling with the 2-year-old's behaviour. The mum had OCD, and there was padding all over the walls and under the rug, and the curtains were closed. And the mum wasn't acknowledging her baby at all. She didn't hold the baby during that first visit. There was no eye contact, and the dad was caring for the baby, waking in the night, feeding, and absolutely exhausted. And the family was clearly struggling. The health visitor continued to visit every week and was going through the MESH programme with the mum, having conversations week on week and talking to the mum about what was going on in the family, and making sure that where the mum expressed a need for support, that support was available to her. But very often the process of just having the talking was doing it. And after week 7, the health visitor was about to leave, and the mum said, I watched Mary Poppins this week, and I think you're my Mary Poppins. The health visitor got really emotional when she was talking about this, and she said, I think that's the nicest thing that anybody's said to me in 16 years. But when she thought about it, she said, as a MESH health visitor, she wants to reflect on all of the interactions between herself and the parents. And so she asked the mum why. And the mum said, well, you come with the bag. The bag's got all of the things in that we've been talking about, plus this shared journal. And she said, by the time you leave after each session, I feel like I've had a spoonful of sugar. So rather than the image of MESH, the health visitor asked me to use the image of Mary Poppins and what they can do with the right tools and the right relationships. And the Mary Poppins bag is the tool that they use with all of the things in it. And it gives the framework and structure to what the health visitors deliver, sits along the Healthy Child programme and addresses those aims. So MESH gave the relationship with this family the time to do the Healthy Child programme and those aims that the core contacts for health visiting wouldn't have done. The family had safeguarding concerns, and the health visitor would have raised them with them, but wanted to wait until the relationship was secure because she didn't think the mother would welcome the discussion. But before she needed to do that, the mother had disclosed the safeguarding issues to her. And that confirmed that the relationship was strong enough for the mum to be able to take more responsibility for herself and her children and be able to have difficult conversations that she felt supported in having. And the health visitor felt that was using the trauma-informed approach allowed her to do that and helped that individual to feel empowered. So the mum now is caring for her child on her own, and she understands what's going on with the baby because of the ready to relate cards. She's understanding the cues and responding to them. She and the father are looking at the 2-year-old in terms of his feelings and needs rather than his issues. And the mum said that was a real eye-opener for her to think about what was going on with the toddler in his own little world rather than what his behaviour and the impact that was having on the rest of them, and very much recognising the voice of the child. So if we move on now, I'll just mention a little bit about some of those things. So I've mentioned before what was in the bag, the Healthy Child programme and the other tools that I've already referenced. And it was delivered through this therapeutic relationship. And with the trauma-informed approach, the focus on the voice of the child and incorporating the rest of the family, the culture, the diversity and the bigger picture. So if we move on to the next slide. And this is the view from the practitioner and the mum about the benefits. So what the spoonful of sugar was. For the health visitor, it was that opportunity to build those meaningful relationships, to have improved job satisfaction, to build skills and knowledge, work with families long enough to see outcomes and change, delivering a service that encourages the whole and not fragmented, and making sure she can, and being able to see the improvements in the relationships over those weeks. And for the parent, the opportunity to care for themselves and to be confident about the relationship with the baby and to care for the baby, the improvement in mental well-being, the improvement in their parent-child relationships, and that was for the whole family, the improved communication within the family, and the focus on the voice of the child. So this is how measures supported behaviour change, and there's a bit of repetition here. So that increase in awareness, the improvement in attachment and the relationship, improved parental maternal well-being. It meant the family didn't need to be referred to other services, and they would have been if they hadn't had the mesh offer. Haven't needed any help from the mental health services, and have not had to have support from the community nurses, the health visiting community nurses, to support behaviour management. They were able to deal with the 2-year-old on their own. And it's developed the ability of the mother to identify her own needs and take on that journey of adapting and self-managing so that she can cope with what comes in the future. Thank you. So, and this is the voice of the child. So the baby's saying thank you. Thanks, Sarah. We're now moving on to Emily from LEAP, talking about enhanced casework. Thank you.
Thanks, Jill. Yes, so I'm going to talk about LEAP's enhanced casework service. LEAP funds a team of caseworkers who are based within the Gaia Centre, which is a wider community service run by Refuge for all Lambeth residents experiencing gender-based violence. And the LEAP caseworkers focus on expectant parents or parents with children under 4 who are affected by domestic abuse. In practice, almost all of their clients are women. The LEAP service model is different from traditional domestic abuse services, and the cycle of change model that Jill introduced here has been central to its design. So it's important first to be clear when using this model in the context of domestic abuse. We're not talking about survivors being responsible for ending abuse. It's about supporting them to understand their situation and the options available to them, and empowering them to take decisions and actions to improve their lives and those of their children. So clients must consent to receive the support. Traditionally, services for survivors mainly focus on preparation, action, and relapse stages. So a survivor recognises that they're experiencing abuse and wants to act, and then they get support that meets their current needs, particularly around safety and practical options, and then the support ends. At LEAP, we've been aiming to reach families as early as possible. So we focused on the pre-contemplation and contemplation stages, when parents may not identify that they're experiencing abuse or feel ready to act. So this means that our casework team needs to go out into the community to proactively find potential clients where they are, using softer language and working to build their trust and confidence over time. For example, the team offer general advice surgeries, which are based in children's centres, and the surgeries aren't overtly associated with domestic abuse, but in the course of conversations with parents, which might be about things like money, housing, or other issues, the LEAP caseworkers can sensitively explore any potential needs around abuse, and then they can offer the full service if it's appropriate, or else do smaller bits of preventative work, or just provide some signposting. So this early intervention approach has really depended on strong partnership working with early years services, and the team having low caseloads, which allows them to engage flexibly with clients. They provide holistic, practical, and emotional support, which is non-judgmental, non-directive. It's led by what the client needs and wants so that they feel in control. It's also not time limited, which means that the team can work with parents through the maintenance stage to really support change that lasts. So the service addresses immediate issues like safety, but it's also really enabling survivors to focus on their and their children's overall well-being and future goals, and to connect with the wider community and other services so they can feel that they're moving their lives in a more positive direction. So thank you for listening. I'm now going to hand over to Stacey.
Thank you, Emily. On screen, you'll see some key data to have a look at whilst I talk you through the Family Mentor service. So our Family Mentors are a highly trained paid peer workforce of local parents employed by voluntary and community sector organisations that are known and trusted within the communities that we serve. They deliver the Small Steps at Home manualised programme of child development and preventative health support to parents through scheduled homes visits in a supportive and strengths-based manner. We currently have 67 family mentors, some of which co-designed the programme before joining the team. 21 languages are spoken amongst the team that represent the families we serve. And the service embodies the Small Steps, Big Changes principle, children at the heart, parents leading the way, supported and guided by experts. As a peer workforce, family mentors understand the needs, challenges, and aspirations of families, and the family mentors themselves have lived experience in the communities. The lived experience underpins the development of trusted relationships between mentor and family. The Family Mentor service has been proven to engage and benefit families we know are typically less likely to access health services, and co-production has helped us to ensure that activities and services provided to families reflect the needs of the local parents. Small Steps at Home visits are delivered in a strength-based, non-judgmental way, and the handbooks can be delivered with flexibility where necessary. It's person-centered approach, and the visits encourage parents to be empowered, enabling them to be informed and make personal choices. And it's important to build confidence with families regarding both the quality and the goals of the activities and services that they interact with, as we find that this is the basis to sustained engagement. The handbooks provide guidance and advice based on key national public health guidelines and evidence-based information, and the handbooks were developed and written by the SSBC partnership. Now, slide 2, please. The programme complements the Healthy Child programme, builds parental health literacy and provides advice directly to the family at an appropriate time, enabling behaviour change, and is reinforced over the period of the service. The Family Mentor service supports families to make the changes they want to improve their lives, and this in turn helps to build parental confidence in their own parenting ability, as parents are their child's first teacher. Nottingham Trent University, who are an external independent evaluation partner, found that parents reported developments in children's confidence, social skills, language and communication, as well as outcomes in other areas such as sleep routines, healthy eating, weaning and toilet training. And they also found that it improves parents' confidence in raising children. So that's me. Thank you for listening, and I'll pass you on to Michelle.
Thank you, Stacey. So my name's Michelle Wellborn. As one of the project managers for ABS in Southend, I'm going to focus today on our parental engagement programme, but particularly the role of parent champions. So this parent champion programme and the wider parental engagement programme really strongly reflects our belief that effective support services cannot be achieved without the inclusion of the people the service is designed to benefit. So this programme is led by our partners, the Southend Association of Voluntary Services, or SAVS for short, and it has been created with co-production at its heart. So with this in mind, we have ensured that the role of the parent champion is featured in all decision-making processes, from designing services to governance forums. Our parents are present and actively contributing their lived experiences and unique perspectives to support the ABS programme. In addition, with support from SAVS, they develop and deliver an engagement programme which ensures that Southend families are better informed about and can gain support from across ABS services. What is significant is the way in which this role has impacted individual parents. So when we're looking at all of the feedback from parents, we can see that a key theme is parents letting us know that the role has enabled them to develop their social and information networks. With parents reporting, this has helped them to feel less isolated and more connected to their community. Interestingly, we can see these growing networks or these systems of support being used by parents as vehicles to bring about change that they feel empowered to enact, which extends beyond each parent champion's social or family circle. So parent champions have reported through feedback that while this increased knowledge and connections has supported their well-being and their children, they've also used this to reach out to more families. So we have parent champions like Ines, who has stated that being involved in the decision-making processes at ABS has given me the tools to be able to speak to other parents in the community who didn't even know that certain services were available. Alison, who is a current parent champion, says that when she was first asked to join, she didn't think she had anything of value to offer. But she now says, I'm so thankful that I said yes, that I believed Jen, an engagement officer, when she told me I did have a valuable voice and experience to share. I actually did not realise how much I needed the opportunity to become a part of something and to feel that I was not alone. I feel a sense of purpose in the absence of formal employment within the role as parent champion. At this stage as well, we can see parents are harnessing this sense of empowerment to explore ways in which they can keep affecting change beyond the ABS programme. So I'll close with words from Sarah, who was a parent champion and has since used this opportunity to become a non-executive director for a new CIC in Southend, City Family. She says, I've got such a network of good people that I just don't want to lose them. The Better Start programme was so good, it needs to live on. And through City Family, that's its way of sustaining the legacy and service for the community. I'm just really, really pleased to be a part of it and be able to have input into what it delivers and what the future holds. So that's just a snapshot of some of our parent champion feedback, and I'll pass on to Natasha.
Thank you very much, Michelle. So I'm Natasha. I am the Early Years Development Support Officer at Blackpool Better Start. I lead our early years work, and I'm currently working on developing a shared approach to school readiness, which is what I'm going to talk to you about today. So, excuse me, children in Blackpool are more disadvantaged in terms of school readiness than their peers. In the school year of 2021-22, there was a 5.6% difference between children reaching early learning goals in Blackpool compared to the rest of England. When tackling these inequities, we have considered UNICEF's 2012 dimensions of school readiness, not only thinking about children's readiness for school, but also early years settings, schools, communities, and families' readiness and their influence. And we've brought together all of these individuals to develop a shared understanding and approach to maximise school readiness opportunities. Our strategic pregnancy and early childhood group brings together key partners to pool expertise and influence systems change. Together, we have identified 9 school-ready priorities based on evidence and local knowledge, and have subsequently developed provision and resources that model those strategies and priorities for both practitioners and parents. We've worked alongside families and the community to co-develop and test the school readiness priorities, provision and resources, and to ensure that they really resonate with them. So far, parents have told us that they find the school ready sessions beneficial and report increased confidence, but they are still unsure about their role in supporting school readiness. Early years settings and schools have found the resources and the sessions useful, but they have asked for more support in their partnership work with parents to encourage them to try the strategies at home. So in terms of our next steps for this work, we're currently further shaping the priorities and the home learning resources with children and families to ensure that they are truly co-produced and really resonate and support parents to better understand school readiness and the crucial role that they play. We continue to work with both early years settings and schools to support their school readiness practice, their provision, and their partnership work with parents. And we're scaling up universal school readiness offers, so working with family hubs and the community to deliver sessions across Blackpool to enable a wider reach. Whilst work up to date has predominantly focused on the role of those adults supporting school readiness, we now want to look at the impact of our work on the individual child to further support a town-wide commitment. We are currently working together to test a simple assessment tool to evidence outcomes for individual child. So far, in preparation for school year 2024-25, we have reached 1,466 preschool children and their families with our school readiness work and partnership commitment to a shared understanding and approach to school readiness. And that's us. So thank you very much for listening. I look forward to some questions.
Sorry, rookie error there. I'll put the sound back on. Thanks to the other sites and the presenters. They're really interesting case studies. Got a few minutes for questions after I do these last couple of slides. So if anybody's got any, if you put them in the chat, we'll pick them up and direct them to whoever it is that you're wanting to know a bit more about. So the key messages, and you'll have picked this up from all of the presentations, is that it's really about building trusting relationships with our families and travelling together to recognise where people are and what their lives are like, and making sure that we're alongside them and with them, and we know what's going on, to make sure we're building on existing strengths and experiences. So very much what parents bring to the table is as important as everything else, to understand the barriers and challenges that our parents face and keep it real so that they don't feel put off by anything that's in the programme. And what we want to change, what the call to action is making sure that when services are being developed for children, that they keep the parents and the children at the heart of them. It's not about the providers, it's about the children. Listen, involve and learn from them. Don't wait to fix things, stop them breaking. Children can't wait until we've fixed, and until they're fixed, they need to be protected from the start, and to do it differently and work together. So thank you for listening to that. If you've got any questions, if you put them in the chat, I will refer them on to whoever they're targeted at. I think we've picked a couple up in the chat already. So there's links there to the family mentors, to the LEAP offer, and to the parental engagement, parent champion work. And obviously, if anybody wants any more information about anything that they've heard today, you can get in touch with us, and there will be a complete report from the conference of all of the things that have happened. So if you missed any of the workshops, you can pick up on those later. Right, it doesn't look as though we've got any questions. We've overloaded people with information. So does that mean we break a bit early, Sarah? We worked really hard to make sure there was question time for this session.
I was just looking along to see if anyone had actually put their hand up, if anybody wanted to ask one live, because we have got about 5 minutes, but I don't know that anybody has. Just trying to check everybody.
Okay.
No more in the chat. Yes, so we can wrap up if you want, Jill.
Right. So yeah, thank you everybody for coming. I hope that you found it interesting, and like I say, if there's anything you want to know about any of the things that you've heard. Oh, there's a question here: what happens once the ABS finishes? I'm not sure if we all know that, but you've heard today from Southend, who have already created a sort of legacy organisation. So I'm going to pass that over to Michelle. She can tell you what's going to happen in Southend.
Oh, that's a really big question. So I think the same as all the ABS programmes around the country, we're all looking at legacy and sustainability both at the same time. You know, what sustains, what can carry on, and what we can do to support our partners to carry on, but also what the legacy might be. So what do we actually leave behind? And I suppose Southend is in a slightly, or correct me if I'm wrong, slightly unique position in the fact that we commission a lot of our services. So we don't often run services. We commission local partners who are based in the community. They know their parents and their families. They are experts in their areas. and we work with them to deliver those services. So a lot of what we're doing at the moment is working with those partners to say, what are your sustainability plans? If you have them, how can we work with you to support that? How can we upskill your staff or get certain things in place in the time that we have, so that you're in the best position possible to keep going beyond ABS in Southend? So because we work with so many different partners, some admittedly, yes, are being picked up by other services. City Family is a new CIC in Southend, which is hoping to continue a lot of really brilliant work with families and with young children. But there are lots of other opportunities available and lots of other partners going out to other different sources and looking at how they can explore different avenues. So it's it would be great to say, oh, this is what's happening in a nice little box and tied up with a bow, but it's very disparate, and we're still in the process with all of our partners of going down that road with them and figuring that out.
Yeah. Thanks, Michelle. And yes, Michelle, as Michelle said, they've created the CIC in Southend, and all of the sites are looking at what happens next. Certainly here in Bradford, we this whole conference will have described some of the things that have already changed, and Mesh now sits solidly within the Care Trust, being delivered by the Care Trust, but commissioned by the 0 to 19 commissioners, and so that's going to stay, and that's part of what happens after ABS goes, and that's similarly with some of the other things that we've done, but and some of the changes that we've made will be carried forward by other people. We are delivering a significant proportion of Start for Life in Bradford, and that may continue. Who knows what's going to happen after the election, but we're expecting something to follow on from that, and that will be moved on from us to other commissioners. So I think all of us, as Michelle has said, are doing different things. I think there's another couple of questions now that we've got going. We've got not much time left. So it says, has the funding increased the practitioners, professionals to work with families, and are we worried we will lose this expertise? That's a really good question, and we are. I don't know if any of the other sites want to answer that, but we think we've developed a really good sort of learning together offer in Bradford. So we're working with students as well to develop this, and that's one of our case studies for one of the other sessions, to develop the understanding of what we're doing with midwifery, nursing and early years students. So we're hoping we can embed those before we finish. Does anybody else want to chip in there to say anything about practitioners? Okay, well, it's absolutely central to the legacy work that we're doing is to build in that continued work with practitioners so that they're skilled up, and that's what we do is a key part of their thinking and their learning. So it's a really good question, thank you. I think we're just about at the end now, aren't we, Sarah? So if there are any other questions that we've not come to, like I said, we will pick those up and they'll be in the event report. But thank you everybody who's put questions forward, but also commented. It's really nice to hear that people have found some of what we've been talking about interesting and useful. So thank you everybody, and see you in the final session.